Let's go on to the classical drug lithium. Lithium is a very old drug. It was used as much as 200 years ago. The clinical uses of lithium include the manic phase of bipolar disease, acute phase illness with psychotic diseases, and to prevent recurrent manic and depressive episodes in mania. The pharmacokinetics of lithium is what makes it so important for us as pharmacologists and practicing physicians. It is rapidly absorbed. It has a half-time of about 20 hours, so it stays in the body a long time. When you talk about clearance, it's cleared at 20% of the rate of creatinine clearance. So we have to monitor plasma levels for 4 weeks when we initiate therapy or when we change the dose. Lithium will cause dehydration. It can interact with diuretics. It can interact with ACE inhibitors. And using these medications at the same time as lithium can cause lithium toxicity. Caffeine and theophylline increase the clearance of lithium. So heavy coffee drinkers can actually have their lithium levels lowered to the point where their disease gets worse. How does lithium work? Lithium has a complex reaction and interplay with the cell membrane and some of the important molecules in the cell membrane. It reduces phosphatidylinositol bisphosphate levels, or PIP2 levels. This ends up resulting in a reduction in IP3, or inositol triphosphate levels. There you have it there. And this causes a reduced synaptic release of amines. So uses in clinical medicine include bipolar disorder, and we often use it in combination with depressants in these syndromes. Remember that antidepressants can also precipitate mania, which is why we like to use these medications in combination. In terms of toxicity, lithium is very complicated. It can cause tremor, ataxia, aphasia. It can cause something called nephrogenic diabetes insipidus. Now, my medical students always get confused when I use the term diabetes insipidus. Diabetes means P, right? So insipidus means weak, so it's weak urine. Diabetes insipidus, weak urine. Diabetes mellitus, sweet urine. So lithium promotes the excretion of almost free water in the urine. It causes a lot of peripheral edema and can cause acne. Leukocytosis is almost always present. And in fact, I've received referrals for leukocytosis, and I take a look at their drug list and find, oh, they're on lithium, don't worry about it. If given in pregnancy, the fetus can develop a condition called Ebstein's anomaly, which is a congenital abnormality of the heart. And in terms of breastfeeding, it is contraindicated because it is secreted heavily in breast milk. Let's take a look at the novel agents used for bipolar disease. Those novel agents include drugs like carbamazepine, clonazepam, olanzapine, and valproic acid, or valproate. Let's take a look at them in more detail, and let's talk first about carbamazepine. Carbamazepine is an anti-seizure medication, and I have mentioned it before and will mention it again. Anti-manic and acute illness is treatable with carbamazepine, and we also use it as prophylaxis during the depressive stage of manic disease. Lamotrigine is one of the newer drugs, and it is extensively used in patients with manic disease. It is also an anti-seizure medication and used in the same or similar circumstances. It also can be used for prophylaxis. Valproic acid, or valproate, is a well-known medication that is used extensively in the seizure treatment of seizure disorders. Anti-manic and acute illnesses can also be treated with valproic acid. Also, it is used for prophylaxis during the depressive state. It is often used when lithium fails. Now, that doesn't mean you can't use it in combination with lithium, and in fact, sometimes we combine valproic acid and lithium together. And finally, the newer drugs, olanzapine and quetiapine, are antipsychotic medications which are approved for monotherapy in milder bipolar disease and more severe psychotic disease. So there you have it there. Have a look at this chart and understand how the drugs are a little bit different but mostly similar to each other.